Hi guys, this is the last chapter 17, the reproductive system. I know that everything has been very fast paced. I know that the lectures have been very quick and kind of to the point. Just please make sure that you're reading through the entire PowerPoint. Make sure that you're going on the simple nursing and the Amobi sisters to find out and maybe get more clarification if there's anything that you're not 100% clear on as far as what I'm talking about. Monday, like I said before, I'll be in room 146 for any kind of questions that you guys may have, or if you're having difficulties maybe getting into things, whatever the case may be. So without further ado, let's go ahead and get started with our reproductive system. This is not too bad. Just make sure that you're paying attention to your diagrams, and I'll make sure that you know which ones that you need to particularly pay attention to. So right off the bat, we're going to go to slide 4. Okay, so your reproductive system. So gonads are ovaries and testes. Okay, so if somebody says gonads, then they're not just talking about the female body or the male body, but they're talking about both the female and the male body. So gonads are the ovaries in females and the testes in males. Okay, so um, their function is to form sex cells, also known as gametes. That's Gametes. Gametes is the scientific name for sex cells. Okay, so make sure that you guys write down that gonads are ovaries and testes, and the scientific name for your gametes is sex cells. Okay. All right, so we're going to go to slide 6. I'm trying to kind of go a little bit slower on this one just so everybody understands everything. So let's go to slide 6. Okay, so your male reproductive system, the primary functions of a male reproductive system obviously is the formation of sperm, the production of male sex hormones, which we'll talk about, and then also for reproduction. Okay, so the placement of that sperm into the female reproductive tract to produce offspring. Okay, all right, let's go to slide 7. Okay, so the male reproductive system, a male has a pair of testes. Okay, there's two. They are outside of the body. Okay, they are the accessory ducts to store and transport sperm, because sperm has to be at a certain temperature at all times, and so it can't be tucked inside of the body. It had to be outside the body for the fluctuation of temperatures. Okay. It is an accessory gland, and like I told you before, the testes are part of the external genitalia of a male. Okay, so your testes is the least amount of fluid to your semen. Okay, so your semen has to have a certain amount of fluid for motility, just for survive for them to be able to survive, things like that. But the testes is the least amount of fluid that is given to the semen. Okay, all right, we're going to keep rolling. We're going to go to the next slide. Your semiferous tubules, those they're lined with that spermogenic epithelium, so it's kind of going all the way back to the integumentary system and the cell systems and all of those things. But they're formed of that spermatogenic and those supporting cells. So on the right-hand side, that is an actual microscopic picture of those semiferous tubules. Okay. We're going to keep going because with the male reproductive system, I want to make sure that everybody kind of understands everything. Okay, so for your testes, they support and nourish the spermogenic cells. They also regulate sperm production. So the testes also have these interstitial cells, and what it does is it fills these spaces between the tubules, and it also produces those male sex hormones. Okay. Um, the spermatogenesis, that is the process that produces that sperm because of the division of those spermogenic cells. Okay, this begins at puberty for males, but it continues on for the lifetime. Okay, and this is controlled by the FSH and the LH hormones. The FSH is your follicle stimulating hormone, and your LH is your luteinizing hormone. For the spermatogenesis, your goal is to form 4 sperm from 1 spermogen. Okay, so you're trying to get 4 sperm from just 1 spermogen. So each sperm has half the number of chromosomes as your other body cells of the male. Okay. So each spermogen divides by mitosis to form another spermogen and the primary spermacide. Okay, so each spermogen, it divides by mitosis to form another spermogen, and that primary spermacide. Because again, the goal is only to form 4 sperm per 1 spermogen. Okay. All right, we're going to go to the next slide. Okay. For this particular slide, the process of cellular division that leads to the daughter cells contains half of the genetic material as the original cell is for meiosis, not mitosis, but meiosis. So that process of cellular division, it leads to the daughter cells containing half of that genetic material as the original cell. That is meiosis. Okay, we're going to go to slide 18. Okay, so this whole process, the end result of that is what I've said before. The end result of the spermatogenesis is 4 sperm. So it's 4 sperm per 1 spermogen. Okay, so make sure you write that down. We'll go to slide 19. Okay, so talked about meiosis, talked about mitosis. We're going to continue with meiosis. Okay, so prior to meiosis, your chromosomes replicate, meaning they clone themselves. It's the same thing over and over again, the same chromosome, right? But each is composed of 2 chromatids that's joined at a centimere. Okay, so I'm going to actually kind of, if I could go back, I would tell y'all to look at slide 21. But during that phase of meiosis 1, the chromosomes align as your homogeneous pairs. Okay, so one thing I do need you guys to write down is that in meiosis 1, the primary oocyte divides to form a polar body and a secondary oocytes, which we're going to talk about later on in our slides, okay? So that in meiosis 1, the primary oocyte divides to form a polar body and a secondary oocyte, okay? So let's go to the next slide. So for the chromosome events, what happens is that during that psychokinesis of your meiosis, the members of each pair, they'll separate into different secondary spermicides. Okay, so each secondary spermicide, they receive 23 replicated chromosomes. I mean, it's the same thing over and over again. You're repeating it. Okay. In meiosis 2, those chromatids separate into different daughter cells. Okay. Like I said, don't get too caught up in it. If you know when I tell you to write it down, just make sure that you write that down. Okay. Okay. So here is the primary spermicide. This is the meiosis 1. Your secondary spermicide and then your meiosis too, because it kind of gives you the steps of how it um, forms those 4 sperm. Okay. Okay, so for your genetic diversity of your sperm lack endoplasmic reticulum for males. Okay, meaning it doesn't really have when you think of like a nucleus, it lacks that outside cover, so to speak. Okay, so sperm lack that endoplasmic reticulum. Okay, so for sperm anatomy, it consists of 3 parts. There's a head, which looks like a head. There's a neck, which in the grand scheme of things kind of sort of looks like a neck. And then it has like this really long tail that is the flagellum. So the flagellum actually gives the sperm that motility. Okay, so if you were to see it under a microscope, it kind of looks like the way a fish will swim in the water. It kind of has that motility to it, meaning that movement. Okay. All right. So we're going to keep going. So for the head of the sperm, that does contain those 23 chromosomes. Okay. And the acrosome. Okay. So the acrosome is like the outside covering of the sperm head. Okay. Your neck and the flagellum, that enables the movement, and the middle piece contains the mitochondria. Okay, so that's kind of like the cell portions of it, for lack of a better word. Okay. For your accessory ducts, your accessory ducts will carry that sperm from the testes to the external environment of the body. And that includes the epididymis, the vas deferens, the ejaculatory duct, and the urethra, which I'm about to show you on the next slide. Okay, so if you'll look here on this diagram, you will see that epididymis, okay, your vas deferens, that ejaculatory duct, and then the urethra, okay? So with this particular diagram, you do need to know this diagram, okay? You need to know pretty much every single one of these parts, okay? But I do want to point out that the penis contains 3 columns of erectile tissue that become functional when those blood vessels dilate. Okay, so when we talk about that, we're talking about that corpus caverosum. We're talking about the the spongism, and then we're talking about the glans penis. Okay. And then that penis is erect due to the action potentials from that parasympathetic part of the nervous system. So, like my continuation is all of the systems of the body is always overlapping each other. So there's never really where you won't hear something about another body system when you're talking about another body system. Okay. All right. So we're going to keep rolling. I'm actually going to go to slide 32. Okay. So for your accessory glands, there are 3. Okay. They are exocrine glands, and they do make secretions that is involved in that reproductive process. Okay. So it's your seminal vesicles, your prostate gland, and then your bulbourethral glands. Okay. We're going to keep it going. I'm going to let you see the next slide. Okay, so here are the male reproductive organs. It's kind of like an inside view of it, in case you are a little confused about where the testes is, or the epididymis, or the prostate gland, whatever the case may be. This will kind of help you figure out where everything is. Okay. Okay, for your accessory glands, the seminal vesicles, they are paired glands on the back of of a male's urinary bladder. Okay, so that duct merges with that vas deferens, and that is what actually forms that ejaculatory duct. So that's where that sperm is going to travel before it exits the penis. Okay. So with the secretion, it is alkaline to help regulate the pH of the semen, okay? But for motility, for movement, it has to have that the fructose, which is pure sugar, and the prostaglandins to help it move, okay? So the secretions that is ejaculated out of a male, it does compose of about 60% of semen. Okay. But I do want you to know that and write down that the alkaline secretions are made by all the male accessory glands. It's not one or the other or two or three. It is literally all of the accessory glands, okay? Which was back on slide 32. It was the seminal vesicles, the prostate gland, and the bulbourethral glands. So those alkaline secretions are made by all of those male accessory glands, okay? We're going to keep it moving. Okay, so for your prostate, okay, the prostate is a pear-shaped gland. It actually kind of wraps around that urethra where it exits into the urinary bladder. Okay, so if a male has some prostate issues, they're going to have that weak stream, or, they may not really be able to pee very much at all or urinate. And then it'll probably feel like they always have to urinate, okay? But that ejaculatory duct that passes through the rear half of the prostate, and that is what joins with the urethra, okay? So the secretions of the prostate, that does aid in the reproduction by regulating that pH, and it also activates the swimming movements of sperm. Okay, and then the prostate gland also, the sperm are activated by the secretion from the prostate gland, which is that donut-shaped gland that encircles the base of the urethra. Okay, so it does look like a donut shape, but then some people do say it looks like a pear shape. Okay, I'm kind of on the fence on both of those. Okay, we're gonna go to slide 36. Okay, so those bulbourethral glands, they're small. They're just these small little circular glands. That's below the prostate gland, and that's near the base of the penis. Okay, not too much. I do want you to read this, but it's not any additional information that I need you to write down or anything like that. Okay. All right, for your semen, obviously semen is the fluid that passes from the urethra during the ejaculation. Like I said, all three glands, that contribute, all three of them do contribute to the secretions, in addition to the sperm and the fluid from the testes. Okay. Now, remember, I told you the testes doesn't give all the fluid to the sperm, but it does give some, not a lot. But the typical volume of ejaculate is about 2 to 5 millimeters. And that equals out to approximately 50 to 150 million, not thousand, million sperm per milliliter. So that is a lot of sperm, in even if you're just talking about two millimeters, okay? That is a lot of sperm, okay? So the production of sperm cells is stimulated by the combination of your FSH, which is your follicle stimulating hormone, that comes from the pituitary gland, and also your testosterone, that's from the interstitial cells in the testes. Okay. All right, we're going to keep going. We're going to go to 40. Okay. So your male external genitalia, that is the visible parts of the male body that you can see with the naked eye. Okay, so that would be your scrotum and your penis. All right. So for the scrotum, that is a sac of skin, and it is tissue that is subcutaneous in nature, and that's what holds those testes. Okay, so the testes do move into the scrotum during about the 7th month of fetal development. Okay, so that descent is controlled by the testosterone. Okay, so when the testosterone secretes, that is when those testes will migrate or move into the scrotum, and that's when mom is about 7 months pregnant with a male child. Okay. That also allows those testes to be kept about 2 to 3 degrees Fahrenheit below the average body temperature, because that is the temperature that is needed in order for that sperm to stay viable. Okay. Your scrotum contains two muscles. You've got your smooth muscle layer, which is the dartos, and then you've got a ribbon-like, it's almost like skeletal in nature, and that's the cremaster. Both of these are used to elevate and depress the testes. So basically what that means is it adjusts the temperature of the testes. If it's too cold, then the testes may drop. Right? If it's too hot, or I'm sorry, if it's too cold, the testes will kind of lift up. If it's too hot, they will drop. Sorry. Okay. But what I wanted to say on this is the pathway for sperm to travel outside of the body. Make sure you write this down. The pathway for sperm to travel outside of the body is the epididymis, the vas deferens, the ejaculatory duct, and your urethra. Okay. All right. So the penis is a copulatory organ that its main function besides urination is to deposit sperm into a female vagina. Okay. So it is composed of your spongy erectile tissue. And the reason why it is composed of that spongy erectile tissue is because it enables the penis to become enlarged and rigid during sexual stimulation. Okay. Let's see, do I need to tell y'all anything about this? No, I don't really need to tell y'all too much about this. Just read it. I don't need to give y'all too much information. I'm trying to give you what you need, and that's about it. Okay. So you're going to move on, and we're going to start with the female reproductive system, because that's about all I needed you to know for the male reproductive system. So we're going to go all the way to slide 60. Okay, so for our female reproductive system, we need to be able to know what the functions of the female reproductive system is, which obviously is to produce those female sex hormones. They also produce secondary oocytes. They do transport those secondary oocytes to where they can unite with the sperm. And then the female reproductive system, it provides that environment for an embryo to grow into a fetus. And then it's also, for the women, it's also involved in the birthing process, because as women, we wear a lot of hats, right? So we're going to move on. This is basically what I just said. Okay, so for the structures of a female, you've got your paired ovaries, which is two, right? You've got a paired uterine tubes, which are also known as fallopian tubes. So you might hear it as uterine tubes, you might hear it as fallopian tubes. It's the exact same thing. You've got your uterus, you've got your vagina, then you have the external genitalia, okay? But the female reproductive tract is your uterine tubes, your uterus, and your vagina. Make sure you write that down. Okay, so your ovaries, those are located near the upper side walls of your pelvic cavity. They are literally the same shape and the size of almonds. They're not big at all, not very big at all. The structure of them is the outer surface is covered by the ovarian mesothelium, and then under that mesothelium are the ovarian follicles. Okay, now that consists of an oocyte that is also kind of padded or protected by supporting cells. And then that inner region has the areolar connective tissue that has the nerves and the blood vessels that keeps our ovaries, the circulatory system, making sure that it gets the proper blood supply and things like that. Okay, oonogenesis, that is the process of actually producing oats. Okay, so it is similar to the spermagenesis, but it's tied very closely to the ovarian cycle. So by the 5th month of mom being pregnant with a female child, the ovaries will contain several million ootogenia. Okay, which is your 46 chromosomes. Okay. Okay. Um, So most of those otogeneas mature into those primary oocytes, which is 46 chromosomes prior to birth. Okay. But the main thing I need you to know is that females are born with their total number of primary oocytes, okay, which is your eggs, right? Approximately 2 million. So you're born with that. It's not something that develops as you get older and you grow and all that stuff. You are born with the number of eggs that you're going to have for your life cycle. Excuse me. Okay, we're going to go to 68. Okay, so at the end of meiosis one, that primary oocyte will divide into two dissimilar cells that are each with 23 chromosomes. Well, they're similar, kind of, right? So the polar body has absolutely no function at all. And that secondary oocyte, that's the one that has nearly all of that cytoplasm, okay, all of the information, right? Um, Also, the polar body is formed due to unequal distribution of the cytoplasm during meiosis, not meiosis, but meiosis. So make sure you write that down. That polar body is formed due to unequal distribution of the cytoplasm during meiosis. Okay. Okay, so I'm just kind of going over this. This is really nothing that you need to write down so much. But that secondary oocyte, that is released from the ovary at ovulation. Okay. So again, the polar body has no function. Y'all hold on one second. Okay, sorry guys. So the secondary oocyte is released from the ovary at ovulation. So like I told you before, the polar body has no function and the ovum has nearly all of the cytoplasm. Okay, so the fusion of the ovum, the nucleus and the sperm nucleus, it forms that zygote, which is the first cell of a quote unquote pre-embryo. Okay. Okay, so here is just so you can kind of follow if you're not quite sure about what Miss Calloway is talking about. This kind of tells you how it goes through the different steps of ootogenesis. All right, your uterine tubes, right? Uterine tubes, fallopian tubes, exact same thing. So they each extend from laterally from the upper side of the uterus to an ovary. So you got one going to one ovary, one going to the other ovary. Okay. So what is the functions of these uterine tubes or fallopian tubes? Well, it's to receive and transport secondary oocytes. It's also your site of fertilization. That is where fertilization takes place between your egg and your sperm, is in these uterine tubes or fallopian tubes. Okay. Then it transports that pre-embryo that we just talked about if that fertilization occurs. Okay, that's when it'll start traveling down to the uterus so that it can implant itself so that it can become what? An embryo, right? All right, we're going to move on. Okay. Um, the infundibulum that partially envelopes that ovary that possesses that fimbriae, which is like little tiny hairs. Okay, so what it does is it kind of moves with those hairs. It kind of moves everything, especially the eggs if they're fertilized. It'll kind of move it towards the uterus. So just kind of think of it as like a hair-like structure. Okay. All right. So definitely need to know this diagram for sure, for sure. Um, so you need to know the uterine tube, the body of the uterus, the ovary, the perimetrium, the cervical orifice, the vagina, the cervix, the myometrium, the endometrium, and the fimbriae. Okay. Also with the cervix, that is the portion of the uterus that protrudes into the vagina. Okay. Meaning, basically, what that means is that your cervix is connected to the vagina. Okay. But the cervix portion of the uterus, that is the part that protrudes into the vagina. Okay. Okay, so the uterus, that is behind the urinary bladder in the pelvic cavity. It's above the vagina and it's kind of bent forward over the urinary bladder. It is a hollow organ with thick muscular walls. Okay, excuse me. That is where your menstrual cycles, that's where that lining will shed every month, right? And it also provides that an appropriate environment for developing embryo or a fetus. Okay, so I'm going to go to the next slide. The uterus does have three major regions. It's got the fundus, the body, and the cervix, which you can see in the diagram to the right. Okay. All right, so the wall of the uterus is composed of three layers. You've got your endometrium, which is that inner mucosal layer. If you look at the diagram, the myometrium, that is that middle muscular layer. Okay, so make sure that you know that that is the myometrium is that muscular layer of the uterus, and that perimetrium is that outer serous layer. Okay. All right, so your vagina is a collapsible tube that does extend from the uterus to the outside of the body, right? It is behind the urethra, but is in front of the rectum, okay? We talked about the three walls, or excuse me, the three layers that it has. You've got that inner mucosa that has that stratified squamous epithelium. The middle layer is that smooth muscle, and then that outer layer, it's got that dense, irregular connective tissue to kind of give it that elasticity feel. Okay, so the female external genitalia, that is also called the vulva. That surrounds the orifices of the urethra and the vagina. Then you've got your perineum. That is the area between the mons pubis and the anus, which we're going to see in the next slide. And then the obstetrical perineum is between the vaginal orifice and the anus. I'm about to show it to you guys. Okay, this is everything that I was talking about. Okay. So we're going to keep rolling. All right, the labia majora, that is the folds of hair that is hair covered skin that covers the adipose, which is that fat tissue, and that smooth muscle. Okay, so that joins in the front at the mons pubis. Okay, and that is formed from the same embryonic tissue as a scrotum for males. Okay, Then you've got your labia minora, and that is the thinner longitude folds that they're medial to the labia majora. So what they do is they join in the front to form what kind of looks like a hood-like covering over the clitoris. Okay, and then that joins that labia majora in the back. Okay, and if you go back to that slide before, you can see exactly what I'm talking about. Okay, so the vestibule, that is the normal space between the labia minora. The urethra does open into the front portion, and the vagina opens behind it. Okay, we're going to keep going. Okay, so your vestibular glands, those lie behind the bulbs on each side of the vaginal orifice. These is what releases secretions into that vestibule. Okay, and then the clitoris, it is formed of two columns of the corpora cavernosa that's near the pubis. But it also has an abundant of sensory receptors, so it's very sensitive to the touch because there's a ton of nerves in the clitoris gland. Okay. So with the female sexual response, in the absence of any kind of sexual stimulation, the erectile tissue of the bulb of the vestibule and the clitoris, they have a very small amount of blood. Okay, so there's not much. I'm not saying there's no blood flow, but it's not very much. But when you is in the presence of any kind of sexual stimulation, the parasympathetic action potentials will lead to the erection of the clitoris, which, if you think about it, is the same as what? As the male, right? As the male penis. So you've got some blood flow, but if there is any kind of stimulus to it, then it is going to lead to it being erected. Okay. All right. So in the presence of your sexual stimulation, the parasympathetic action potentials, they will cause enlargement of that vaginal mucosa, the breasts, and the erection of the nipples. Okay, so the stimulant vesicular gland, it will secrete to lubricate the vesicles. Okay, and then you also have sexual responses that culminates in like orgasm, same as in males. Okay, so the orgasm is initiated by those action potentials from the sympathetic part of the nervous system. That's for females and for males. Okay. Let's see. So also that sympathetic action potentials and those prostaglandins in the semen, they trigger reverse peristalsis in the pelvic floor muscles, the uterine wall, and the uterine tubes. Okay, so what does that do? That just helps move the sperm through the uterus to the upper uterine tubes to possibly fertilize an egg. Okay, so we're going to keep going. For the female sex hormones, you've got your estrogens. That is produced by the ovarian follicles that are exposed to your FSH, which is your follicle stimulating hormone. Those also stimulate the maturation of your female sex organs, but it also stimulates development and also the maintenance of your female secondary sex traits, okay? Which would be what? The development of your mammary glands and your breasts. For females, we have that broad pelvis, okay? We also have the increased subcutaneous tissue deposition, also increased blood supply to the skin, and also the development of your axillary, which is the hair under your arms, and your pubic hair, okay? Your progesterone, that is produced by the corpus luteum, that is after ovulation, and it is under the stimulation of that LH, which is your luteinizing hormone. Okay. That is a major, 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 major role in development and also the maintenance of that endometrium, which is the lining of the uterus during pregnancy. Okay. But it also inhibits the uterine contractions and the dilation of the cervix so that you don't deliver your baby too soon. Okay. So with your female reproductive cycle, there are two cycles that are hormonally controlled, and they occur simultaneously starting at puberty. That is your ovarian cycle and your menstrual cycle. Okay. So the menstrual cycle, that is every what, 28 days? Hopefully you don't have it more than that. And it's repetitive changes in the endometrium that causes that monthly menstruation if pregnancy is not occurring. Okay. The ovarian cycle is again also monthly. It's a formation and it also releases that secondary oocyte, and then the ovarian events that occur in anticipation of a pregnancy. So I say all that to say this: your body every month is getting ready for you to possibly get pregnant. Okay. Your cycle lengths are range from like 24 to 35 days. 28 days is about average. Some people, may go a little bit longer, maybe a little bit less, right? So obviously, your cycles will continue at puberty. For some people, that might be 11. When I worked in pediatrics and also OBGYN, I had some of females in pediatrics that had precocious puberty, which means you're going to puberty really young. And I actually had one patient that was actually she started her cycle when she was 9 years old. Those cycles do, approximately 11 years of age, maybe a little bit younger, maybe a little bit older, and you will have them until menopause. Okay. Menopause is literally the cessation of having your menstrual cycles, meaning they stop. And that normally happens between the ages of 45 to 55. Okay. This is just a visual of a female reproductive cycle. Okay. Your ovarian cycles, this begins at puberty, again, approximately age 11, with your first menstruation. Puberty starts at 11. Menstruation, like I said, it kind of depends, but the menstruation for textbook purposes is approximately age 13. Okay. So during the follicular phase of each ovarian cycle, you've got your FSH, which is your follicle stimulating hormone. That promotes the development of the approximately 20 ovarian follicles, and that kind of morphs into the primary ovarian follicles. Okay. I'm just kind of talking. There's not really much I needed you to know until 99. So we'll just go ahead and skip to slide 99. Okay. So for your ovarian cycle, the rapid increase in your blood LH, which is your luteinizing hormone, that causes that maturation of your fertility ovarian follicle to actually mature into that ovarian follicle. Okay. So that stimulates that completion of meiosis 1, and that moves it to what? Your secondary oocyte. Okay. Then that stimulates the ovulation of that secondary oocyte, and that occurs around 14 days prior to the onset of your next menstruation. Okay, so ovulation is a secondary oocyte that is released from an ovary and carried by the uterine tubes towards the uterus. Okay, let me get back to my notes because I'll just sit here and talk. So ovulation occurs around day 14. Okay. But after ovulation, that's when your luteal phase begins. That's where that LH, which is that luteinizing hormone, it'll stimulate any remaining cells in the ovary to become that corpus luteum. Okay, so then it secretes that progesterone in some estrogens, and that is for approximately 10 days after ovulation. Okay, so that means that the elevated blood progesterone level that inhibits that GnRH secretion. Okay, don't think too much into that. Just know that the ovulation occurs on day 14. Okay. We're going to go to, let's go to, I do want to talk about menopause. There's really not much you need to know about menopause, but I do want to talk about it for a second. So let's go to 108. Okay, menopause. That's when you no longer have those regular menstrual cycles, okay? It usually begins 45 to 55. That's textbook. It could be sooner, a little bit later than that, and it can last up to 10 years. What causes menopause is caused by the aging of the ovaries. So you've got fewer primary ovarian follicles that exist to be able to respond to the follicle stimulating hormone and your luteinizing hormone. And your eggs are no longer, I'm sorry, your ovaries are no longer ovulating. Okay. So the secretion of the estrogens and the progesterone, it curtails, meaning it drops off pretty quick. Okay. For menopause. Okay. The symptoms of menopause is all of this and some. There's a lot of it, but these are probably the most in-depth ones. Hormone replacement therapy can treat symptoms, but if you have any kind of female cancer history in your family or you yourself, they're probably not going to want you to do hormone replacement therapy for too long because it does increase the risk of breast cancer, heart disease, strokes, so forth and so on. Mammary glands. We did talk about the mammary glands and the breasts in the endocrine system. So this is probably going to be kind of a review for you guys. So I'm going to go straight to slide 112. Okay, for your mammary glands. So at puberty, for us females, the hormones stimulate the development of your female mammary glands. Okay, so the estrogen that starts that breast and mammary gland development. Okay, so that's when you hit puberty, for us females, we start getting breasts, right? As we get older, and we are, to the age of having babies and things like that, and we get pregnant, the progesterone will stimulate that mammary gland maturation so that it can start secreting milk. Okay. And then your prolactin, that is the third hormone that is also required for milk production. So a lot of people think it's just progesterone, but it's actually prolactin also. That's why it takes a few days after you have a baby for your milk to actually come in. Okay. But please make sure that you know that the progesterone stimulates those mammary glands to mature, so that they can actually secrete that milk. Okay. And then your alveolar glands, those are functional portions of the mammary glands which produce milk by stimulating that prolactin hormone. Okay. Let me see what more we got, what more we have to go through. I think this is it for female. I think this is it for everything. I do encourage you to read the entire PowerPoint. Please do the simple nursing. Please do the Amova sisters. I think I did see, if I'm not totally mistaken, because I've been looking at this stuff a lot the past couple days. I'm pretty sure they had a video on this too. So make sure you guys take advantage of that. Like I said, I know this has been a lot and I'm sorry. I'm trying to get it, as compressed as possible so you guys only have to have what you have to have. But I hope this helps. And then, like I said, I will see you, for those of you that need to see me on Monday, I will be there in room 146. I'll be there as soon as I can. Y'all have a great day and I will see or talk to you later.